Hello, welcome to the Pain Care Specialist Facebook Live interview with Dr. Youngeun Cho. She will be talking about the role of pain psychology in chronic pain management. And we're also here with Dr. Andrew O, who had talked previously about remote patient monitoring, and both topics go hand in hand. And we'll start with Dr. Cho's presentation. How are you, Dr. Cho?
I'm good. Thank you for having me today.
Good.
Connected to PCS38LL5.
All right.
All right. Can you hear me okay?
Yeah,
Yes.
I can hear you now.
Sure. Then we can get started with the presentation. So yes, I'm Dr. Cho from Pain Care Specialist of Oregon, and today we are going to talk about the role of chronic pain psychology. And we'll also briefly touch on the NeuroFlow program that we are using for our patients and at the end of the talk as well. So chronic pain is one of the most disabling and burdensome conditions, and a lot of patients typically present with multiple and overlapping issues such as depression, anxiety, insomnia, loss of social roles, or isolation. And studies have shown a strong association between various psychosocial risk factors and chronic pain. For example, depression can affect about 5% of the general population, whereas the number can go up to 30 to even 45% in patients with chronic pain. And the relationship between depression and pain is bidirectional, meaning that having chronic pain itself can increase the risk of developing depression and vice versa. And interestingly, imaging studies using MRI also confirmed an overlap in the brain areas associated with various features of chronic pain and with the areas affected by depression. And of course, there are other risk factors to consider other than depression, including anxiety, passive coping, pain catastrophizing, fear avoidance beliefs, and so on. But unfortunately, these psychosocial comorbidities may not be addressed or managed appropriately in chronic pain world. And it is a big problem because now we understand that these risk factors can increase the risk of developing even worse psychological conditions and also result in resistance to chronic pain treatment. And it's also important to remember that these conditions can actually serve as a stronger predictors of the outcome of our pain treatment than imagings or biomedical labs that we use all the time. So in the next few slides, we're going to review some of the risk factors to improve our understanding, and we can start with the passive coping. It basically refers to the attempts of the patients to avoid confronting their pain-related problems directly. Whereas when patients are doing active coping, they're actually making cognitive and behavioral attempts to deal with their pain-related problems directly. And through the process, they learn to function in spite of their pain. And passive coping has been shown to interfere with the overall pain treatment outcomes because the emotion and behaviors associated with learned helplessness from passive coping will have negative impact on patients' sense of control. And pain catastrophizing is also very common in chronic pain patients, and it refers to negatively distorted perception of pain as this awful and uncontrollable state. And it involves constant magnification and rumination over their pain symptoms, and patients will often feel helpless and pessimistic about their pain and their future in general. And not surprisingly, many studies have shown very strong association of pain catastrophizing features with depression and chronic pain. And functional MRI study showed that patients with pain catastrophizing had increased brain activities where there's a lot of anticipation, attention to pain, and emotional aspects of pain are getting processed. And fear avoidance belief is very important to identify early on in the treatment course of chronic pain. It means that patients have this anticipation of increased pain, and it can lead to constant monitoring of their pain sensation. And as a result, even very low intensity discomfort can turn into intense pain. So again, it's about the anticipation of higher pain or re-injury, and it can actually stimulate avoidance behavior and create vicious cycle of inactivity, which can then lead to long-term disability. So how can pain psychology help with these? It starts with the realization that all of these negative thoughts about pain can result in increased pain and distress, decrease the functional capacity of the patients, and also result in greater dependence on medication. And the goal would be to identify these negative and maladaptive emotional and behavioral reactions and come up with a tailored and individualized pain treatment to optimize the outcome. And of course, the relationship between pain and psychology is very complex and multifactorial. And that's why we always try to come up with an interdisciplinary model where physicians from various specialties, psychologists, and other clinical specialists all come together and formulate a multimodal plan for each of patient's case. And kind of focusing on the psychological treatment, it always starts with good patient education to improve their insight and understanding on what chronic pain really is. And it also involves relaxation training, which can be applied to our patient's daily life. And also identification of negative thoughts that we just reviewed, and activation of positive and constructive behaviors. So in the next few slides, we're going to review some of the most commonly used pain psychology techniques. And we'll start with the cognitive behavioral therapy, or CBT. It is the most commonly used intervention for patients with chronic pain. And it involves changing those negative thoughts about pain and adopting positive and constructive ways of coping with the pain. And through the process, patients will learn that they can actually self-manage their pain and respond to the pain issues in a more positive and adaptive ways. And studies have shown that CBT can help patients to restore their function and reduce the pain intensity. And it can address not only just the pain, but also the depression, anxiety, and really improve the overall quality of life. And it is because those cognitive symptoms that we just reviewed are really important and significant predictors of the therapeutic response to our pain treatment. And by addressing those neurocognitive functions, we can reduce the pain intensity and also increase the chance of obtaining functional remission. And next is biofeedback, and it can be very helpful for our patients as well. It involves various monitors and electrodes, and patients get to monitor their vital signs and control the physiological process that actually plays an important role in regulating the nerve system that is highly associated with transmission, generation, and maintenance of pain signals. And usually patients will monitor their own heart rate, temperature, breathing patterns, and also incorporate data from the muscle and brain activity feedback. And the advantage of the biofeedback is that patients get to see that instant feedback right away, which indicates patients' measurable level of stress. And eventually they will learn to control and reduce their pain without relying on the monitors. And it's been shown that biofeedback can improve the outcomes both in the short and long term. And next is meditation, which is gaining popularity nowadays. It's about self-regulating attention on particular aspects of patients' pain experience. And it's been shown to have positive outcomes on pain, overall coping skills, and mood disorders as well. And there are a lot of evidence out there that showed significant improvement in depression and overall physical and mental health related outcomes. And there are studies that show small but positive effects for specifically chronic back pain, fibromyalgia, and other musculoskeletal pain problems. And lastly, hypnosis can be helpful for certain patients, and it involves hypnotic induction with suggestion for relaxation and comfort. And the psychologist can teach the patients how to induce self-hypnotic state using a simple cue, like taking a deep breath. So eventually, patients will learn to create a state of comfort by themselves, and they can do this on a daily basis as needed for their pain. Um, and they can also apply this for other issues, such as improving their overall activities, developing more adaptive coping skills, and improving sleep quality. And again, studies have shown that post-hypnotic state for reduced pain can even continue beyond the hypnosis session. And the results, the changes in the brain activity following hypnosis were consistent with those changes that we see with pain relief. So let's briefly talk about the NeuroFlow. I think a lot of our patients may be already familiar with it. It's a HIPAA-compliant digital health platform, and it offers a lot of self-care activities for our patients. And patients can actually track their mood, sleep patterns, and pain levels over time as well. And providers get easy access to various assessment tools and surveys to ensure safe opioid use and also to screen for various mood disorders. So basically, we are hoping to integrate behavioral health into our patients' everyday pain management. And other than the routine questionnaires and surveys that patients used to fill out in the clinic, they'll have access to other various resources, such as journals, introductory materials and videos on CBD, CBT, guided breathing, meditation, and positive psychology. And if patients have specific conditions like fibromyalgia, depression, any difficulties with tobacco cessation, and so on, they can also get more resources on those specific topics through NeuroFlow as well. So we encourage our patients to really take advantage of the system and complete those assessments before their monthly appointments so that we can track everything together and see if we can optimize any of the pain treatment for our patients. So again, we're hoping to improve our patients' understanding of the role of psychology in chronic pain management and also improve their coping skills. So in summary, treating chronic pain should address both physical and psychosocial aspects to achieve the optimal outcome. And pain psychology, it starts with identifying the maladaptive and negative emotional and behavioral changes and improve the quality of life by treating those aspects. And as a result, we can reduce the pain intensity and maximize the functional capacity in the long term. And there are various psychological techniques that can be used, and we usually see the best outcome when patients practice a range of methods and tailor it to their individual pain need. So we just want our patients to understand that when we recommend pain psychology, it's not because we don't believe in the fact that your pain is real. It is to provide more tools the patients can use in their daily lives so that we can optimize and improve the outcome following our pain treatments. And that concludes our presentation.
Thank you, Dr. Cho. That was really wonderful.
Thank you.
Very informative, and I really think this highlights a lot of what our patients don't quite understand, and we do a lot of education in our clinic, and it is really trying to get them to buy into this idea that their mental health plays a huge role in their pain management, and the effects really are widespread, and they are powerful, and it really is a another aspect to their treatment aside from the different things that we do that we actually, you know, physically do to their body, injections, procedures, surgery. This plays a big part of that, and we really want to help patients understand that better. And I think you did a really great presentation there. Polly, anything further?
To use the NeuroFlow, I missed the part about the pain care specialist new application that we designed. Dr. Cho, how has that been going?
So yeah, I had a lot of patients who like the NeuroFlow, and we are always encouraging our patients to complete the monthly assessments so that we can track everything with them. And if you find any alarming results or concerning results on the surveys, then we kind of go over that together and see if we can refer them to a specialist to talk about their issues, or maybe recommend medication changes for their current providers. So we've been able to pick up on those aspects of chronic pain a lot better using NeuroFlow.
Great.
What you did mention partly about some of the barriers for patients in utilizing mental health treatment. Can you mention any other common barriers that you see from your patients in terms of either educating patients or getting them to understand how pain psychology works, or getting them to, be okay with being referred to a pain psychologist?
Right. I think a lot of patients, when they hear pain psychology, it automatically means that we're going to stop treating their pain with injections or medications, and we're just going to focus on psychological aspect of their chronic pain, and that is not the case. So I think it just starts with really just making sure that our patients understand why we're making or recommending pain psychology as part of their pain treatment. And as we just reviewed, it can really provide a lot of different tools that patients can actually use in their daily life, which is different from like injections and procedures. So that's why we try to introduce this tool to our patients so that we can improve the overall pain treatment and improve the outcome. And so I think it starts with better patient education so that they really understand why we're recommending this specific tool for our patients' pain treatment. And sometimes they've talked to a counselor or a therapist before and didn't really feel that it helped with their pain. But the difference with the pain cycle is that we're really going to focus on pain related issues and really tailor and provide a tailored and individualized treatment tools that patients can utilize in their daily life. So, and this is such a low risk, intervention that we can take. So I think it's something that all of our patients can discuss with their providers in the near future and see if we can incorporate this into their, daily pain management.
Yeah, I really like that idea of self-care. That idea really should resonate a lot with our patients. Instead of having to rely on coming into the office and getting an injection or getting a medication, this idea of self-care, of when they're having increased pain, when they're having difficulties, there are tools, mental health tools, physical therapy tools, things that they can do for themselves at home. And that really helps with that hopelessness, and that really can empower patients to take more control of their own therapy, and it can pay big dividends for patients.
Right.
We have some patients wondering when is it time to really start mental health treatment, or even treatment for their anxiety that's associated with their chronic pain. When do you think we should be initiating that talk with patients about how their mental health is affected by their chronic pain?
Right. I think, the earlier we start treating the psychological aspect of chronic pain, the better, because a lot of studies have shown that if patients already have high levels of anxiety or depression, no matter what intervention we provide, they're significantly more likely to be unsatisfied or unhappy with the result. So it just shows how much of impact, psychology has on chronic pain and its perception. So I think it's really important to bring it up early on so that we can optimize and address and optimize these risk factors first. And then we should be able to see even better results with the future treatment plans.
Dr. O, how is Dr. Cho's remote patient monitoring of the mental health using NeuroFlow at Pain Care Specialists similar to what you talked about in terms of remote patient monitoring for diet and lifestyle management?
Again, I think it's about treating the patient as a whole instead of just treating one aspect. That really, that multimodal approach is the most effective way to treat chronic pain. Improving one's overall health with diet, which can, help with different aspects of their lives, including, high blood pressure risk factors, coronary artery disease risk factors, cancer risk factors. If your overall health is better, it's going to improve your chronic pain. Same goes with mental health. If your overall mental health is better, you're going to be able to deal with chronic pain. You're going to be able to improve with the treatments, and you're going to respond better to treatments. So I do think all of this really melds really well together within our clinic.
That's excellent. Now we have some patients who will say they're wondering, well, I'm not crazy. I'm just upset with my chronic pain. Is that a normal thing? I mean, how do we respond to that?
Yeah, again, I think it starts with better patient education and kind of stress that the fact that we're recommending pain psychology is really to provide the patients more tools that they can use in their daily life to deal with the chronic pain in a more positive and constructive way. And sometimes we cannot really go over everything during our clinic appointments. And it really helps to sit down with a psychologist and other specialists and really focus on this particular aspect of chronic pain so that we can really understand individual patients' needs and differences, and then really come up with a tailored plan. So I think the most important thing is, again, patient education. Really make sure that they understand why we're making this recommendation, and then we can always start from there.
Yes, I agree. I think that normalizing and going away from that stigma of mental health means that you're somehow unstable, mentally unstable. The education part plays a big role in normalizing that and saying, look, you're not the only one who has chronic pain, and you're not the only one who suffers from mental health. I mean, it goes linked. It's hand in hand with each other. So I think that is the most important part, is just helping patients feel comfortable about addressing those issues.
Makes you wonder if group therapy with NeuroFlow or even this forum may be useful. That's a possibility. What do you guys think?
Well, absolutely. The psychologists, they often do group therapy, which is very helpful to see other patients going through very similar issues. And I think that really helps them kind of come to terms with the issues that they deal with.
Good. Well, Dr. Cho, fantastic job on this very informative topic and very important topic at this time in particular. And Dr. O, this ties in very well with the remote patient monitoring. I think the NeuroFlow at Pain Care Specialists of Oregon, the remote patient monitoring from our providers, Dr. Cho, Dr. Vu, Dr. O, Nash Keen, David Keen, Don Winder, it's all so important. Next week, we're thinking about introducing Dr. Yaw Sarpong, a neurosurgeon at Pain Care Specialists of Oregon, and we'll give you some updates about his presentation in the next few days. We thank you for joining us. Dr. O, any other questions?
No, I think we did Dr. Cho did a very good job of going through all the different factors and informing patients about how this impacts their chronic pain.
Thank you, Dr. Cho.
Thank you.
All right.